So maybe in the interest of time, let's get started. I think that other people have signed up for the session and they will progressively be able to sign up and join this discussion. Let me start by saying good morning, good afternoon, and good evening to everyone. My name is Silvia Gaia, and I am the Senior Advisor at UNICEF, leading the global agenda on water, on climate resilient WASH, but also on WASH in healthcare facilities and schools. So I wish to welcome all of you to this very important session on supporting resilient communities through sustainable WASH and energy services in healthcare facilities. And I am really glad to see that there is a lot of colleagues that we know from the sector that are getting connected and are joining here with us today to hear about what the speakers have to say in this session that from my point of view is very relevant, because washing healthcare facilities is and always will be a very important part of our sector, especially now when the world is going still through these very difficult times with the COVID-19 pandemic and amidst the climate conditions impacting a large number of countries around the world. So as you may know, climate resilience and the use of renewable energies is really at the heart of UNICEF programs. And I am really very passionate and very committed to see the sector progress on this. And I am delighted, of course, to be part of these sessions. And I believe that all of you at the end of these sessions will have learned a lot and come up with some forward ideas for making climate and energy an integral part of washing healthcare facilities. So today we have a lot of speakers, very distinguished speakers from governments, from partners, and we will hear their experiences, their challenges also, the opportunities for collaboration, case studies that they will present, innovation, all the things that they are doing to scale up WASH and financing for washing healthcare facilities. So you will see it's a very rich session with a lot of interventions. We will also have a very interactive session on shared agendas and joint action and statements of action from partners and the next steps. Let me also remind you that we will welcome your contributions, comments, and questions on the chat box. We will try to answer as much as we can your questions, and we will be there for answering during or after the session. So since the time is very tight, let me now invite Victoria Rayleigh, IPC focal point in St. Timothy Government Hospital in Liberia, to give her remarks on implementing climate resilient WASH and energy in healthcare facilities. Over Victoria, thank you.
My name is Victoria Rayleigh. I work as the IPC focal person with the Green County Health Team. I have been trained to use the WASH Fit tool in supervising health facilities in county. Water, one of the components, is very essential in providing health care. In Grand Cape County, we face a challenge when it comes to water. Most of our facilities depends on hand pump as the water source. Our facilities have hand pumps on the premises, but some facilities hand pumps are damaged. They have to collect water from hand pumps within the community. And this puts a problem when it comes to storage system. Facilities do not have the system to store water for up to 48 hours. Water has to be collected daily for use in a healthcare facility. Treatment tool is also a challenge. Our hand pumps are not treated on a regular or quarterly basis, so you will not have the quality of water needed for use. When it comes to the quality of water, we look at the climate, the changes in our climate. During the dry season, most of our hand pumps dry up, so you will have the struggle to get water. During the rainy season, you will have an overflow of water, but then this poses another problem when it comes to the color of the water. The water changes color, and then you will not have good quality of water for use. Another challenge that is faced at our healthcare facility when it comes to energy. Most of the facility uses solar power for energy. So during the rainy season where you have low sunlight, you have low energy, and at night performing services becomes a challenge where you will not have light to use. Clinicians have to be using their phone lights, they have to be using flashlights to conduct service like delivery. My name is
Thank you. You have seen Victoria Rayleigh from Liberia really expressing some of the key challenges that they are facing in terms of water quality, water itself as not being always available, and of course about energy. So this will be one of the things that we will try to see how can be addressed and what can we do about it. So now let me just give the floor to Maggie Montgomery, Elena Villalobos-Prats, and Salvatore Vinci that are from WHO. They will explain us and talk about the strategic framework and global efforts to address climate resilient, wash, and energy in healthcare facilities. So over to you for the next 15 minutes. Thank you.
Thank you very much. I think I will start from the climate change unit, because what you will see is a quick presentation from the energy, climate change and wash units, basically showing the complementarity of our approaches and tools to healthcare facilities at country level. This is just a first slide to introduce the key areas of work in the climate change and health unit. Basically, there are 3 areas. One is addressing the health impacts of climate change. The second one is strengthening climate resilience and environmental sustainability in health systems and healthcare facilities. And then the third one is promoting and maximizing health co-benefits of mitigation policies in the key determining, responsible for emissions sectors. Next slide, please, Maggie. This is just a quick overview of the approach that we have. What you have in the left is basically the operational framework for building climate resilient health systems, which is basically something that we develop working with countries and implementing interventions at country level. We basically took the building blocks of health systems and developed a total of 10 functions that need to be strengthened, integrating climate and weather considerations just to ensure that health systems become resilient to climate change. A key one is health information systems, so everything related to surveillance and the integration of climate and weather information. But then the most important today is the one related to climate resilient and sustainable technologies and infrastructures. And what you have on the right is basically how we further develop this framework to basically focus our work on climate resilient and environmentally sustainable healthcare facilities at country level. So what we do is basically we have key 4 areas: health workforce, energy, water sanitation, hygiene and waste, and then infrastructure, technologies and products, which includes everything related also to procurement. And basically in all these components, we basically also develop interventions and approaches to understand vulnerability and all the part related to resilience, but then also everything related to environmental footprint, carbon footprint, and how to implement interventions to reduce this environmental footprint. And then what you have in the left is basically the overall guidance that we have to implement these interventions. Next slide, please. This is the overall framework. I will not go into detail, but basically it's putting together how what you have in the, again, climate change and the different impacts that and hazards that is going to occur and that healthcare facilities will face. Basically, the 4 components, different objectives under each of those, and then basically how functioning healthcare facilities basically also release waste and release greenhouse gas emissions and everything that can be, but not only for the environment, but also for health. And then it's a loop again, because basically they will increase overall climate change. Next slide, please. Sorry if I'm being too fast, but I want to limit my intervention to 5 minutes. Then this is the process that we basically have to strengthen climate resilient and environmentally sustainable healthcare facilities. And then the most important that I wanted to highlight is the one related to baselines. So basically, in addition to the overall framework and proposal for interventions, we have specific tools to assess vulnerability in healthcare facilities in relation to climate change. So basically looking at each of these hazards, depending on the country, it will be flooding, stream I mean, basically all extreme weather events, increase in temperature, increase in water temperature, sea level rise. Basically, they have a full set of options to conduct basic checklists to assess this vulnerability. And then we also have tools developed by others, like, for example, AGACAN Development Network and Healthcare Without Harm, to support countries understand and establish their baselines with regards to greenhouse gases. Once this baseline is established, they will understand which are the areas where they will have to basically implement their interventions. And these tools are being piloted already thanks to the support from SIDA and FCDO in countries in WIPRO, CRO, and AFRO. Next slide, please. This is the last one, and I think Dave will provide further insights into the COP26 health program. Basically, this is an important year for everybody, for the whole humanity, because basically, hopefully, we will get some commitments to reduce the climate change. But it's very important for health because for the first time, there is a formal health program under the COP presidency. We are very involved with FCDO, basically in trying to engage countries and make them commit basically to two key initiatives. One is related to climate resilient health systems and the other one related to sustainable low carbon health systems. What you have there, the first three commitments are related to the climate resilient health systems, and basically countries will have the opportunity to conduct vulnerability and adaptation assessment, basically develop the evidence linking climate change to health or healthcare facilities. So all the resilience bit could be covered also for healthcare facilities. And then develop plans for basically tackle all those impacts. And then what you have in the down, basically the last 3 points are the commitments related to low carbon sustainable health systems. So basically all countries will be invited to consider their commitment to understand which is the greenhouse gas or the carbon footprint or their health system overall. But then this could be done also bottom up, just assessing healthcare facilities and combining and aggregating all the information until you get to this top-down information. And then also just basically develop a roadmap to get themselves into a sustainable low carbon path. So this is all. I hand it over to Maggie. Thank you, Maggie.
Great, thank you, Elena. So on WASH, many of you are well aware of these figures, but just wanted to highlight in particular the inequalities in the least developed countries. So already there's huge gaps when we look at low and middle income countries, but the least developed, we see 70% are lacking basic healthcare waste management. And this has only been aggravated by COVID and all the amount of extra waste that's being generated, but it obviously has important impacts on the climate as well. Similar gaps in terms of water, and as we heard from our colleagues in Liberia, really interesting to understand that, you know, it changes by the season. There's issues around water quality and availability. We now have data from 60 countries, and these are, this is data that links to the World Health Assembly resolution in 2019, when all countries committed to ensure universal access to WASH and healthcare facilities by 2030. There's been a lot of progress in terms of standards, as well as conducting national baselines, and we heard from Elena how important that initial baseline assessment is. But when we drill down to looking at whether or not countries have plans with dedicated budgets, that's only 1 in 3, and fewer than 1 in 10 countries are actually regularly monitoring water, sanitation, and hygiene within their health systems. So these are important gaps that we're working to address now. One tool and way in which that's being addressed at the facility level is through WASH Fit, which is a joint UNICEF WHO improvement tool that looks at water, sanitation, hygiene, and healthcare waste. We have an updated package. It's now out for review. So if you would like to provide comments, please reach out to myself or visit the WASH and HCF website. Things that are new is a much greater focus on streamlining climate considerations, both on the indicator and the monitoring side, but also on the intervention side throughout, as well as energy and gender, because those are three important gaps that we recognize were not there. Also strengthening the way in which we track implementation and results, so we can better understand what's actually working in the field and better support all of those users and implementers to do WASH better. I just wanted to highlight a few integrated efforts. We do have Laos and Ethiopia participating today, so it'd be better to hear directly from them. But in Ethiopia, we see that WASH and energy has been integrated into their quality as well as their climate smart guidelines. In Laos, there's been some impressive recent work of raising over $2 million locally through COVID funding mechanisms to implement climate resilient WASH with a particular focus on healthcare waste and hygiene practices, and similar really interesting work happening in Madagascar and Philippines. So there's a lot of interesting work happening on the ground, but we're also trying to make sure at the global level that we're asking the right questions, that we're engaging multi-sector stakeholders to really try to better understand what are the key bottlenecks and address them. So one way is through the task force on WASH in healthcare facilities, and really honored that we have the co-chair, Dr. Anshu Banerjee, who will be doing the closing with us here today. He's the director of maternal child health at WHO. But this task force is made up of a number of individuals from private sector, from the UN, from NGOs, and from government to really try to better provide some insights into issues around effective training and technical guidance, around financing, around how do we really thoughtfully and meaningfully integrate with key health programs such as child maternal health and antimicrobial resistance. So I'll end there. In the Global Progress Report, which WHO and UNICEF published at the end of last year, we highlighted 4 key areas where we need action. That's around plans and budgets, around better monitoring and review, around making sure we integrate WASH throughout the healthcare sector planning, budgeting, and programming, and at the end of the day, making sure that the health workforce has the right tools and the right support and the right incentives to engage in good WASH practices. We have just launched the new and improved global knowledge portal, washinhcf.org. So I really encourage you all to visit that. You can even load and share materials in it yourself. So thank you. And I'm going to hand it now to my colleague Salvatore to talk about energy.
Thank you, Maggie. Thanks a lot. Good morning and good afternoon and good evening to all participants. As we can see from this slide, and as we all know, energy is indeed crucial for health services. As we know, it's required for the operation of critical medical devices. We think about vaccine refrigerator, baby warmer, oxygen concentrator, and etc., and many others. It is also essential for basic surgical and diagnostic equipment. In general, electricity is enable a wider range of services and prolonged opening hours. Access to electricity, especially in rural areas, can also facilitate recruitment of staff and retention of staff, in addition to general sense of security and safety of patient and staff. Next slide, Maggie, please. Thank you. Sustainable energy, in particular, renewable energy, goes beyond SDG 3 on health and SDG 7 on energy. As Meg and my colleagues Elena have highlighted already, there are many links between energy and water sanitization and hygiene, and between energy, especially decentralized renewables, with increasing climate resilience of healthcare facility. But sustainable energy also help reducing polluting emission, for example, compared to fossil fuel, and help increase worker occupational health and safety. So the link and the benefit goes really beyond the two clear SDGs. Thanks, Maggie. Although it's clear, it's so clear that electricity plays an instrumental role in health service delivering, unfortunately, the situation today is that still 1 billion people are served by healthcare facilities with no access to electricity at all. In particular, 26%, which means 1 in 4 healthcare facilities in sub-Saharan Africa have no access to electricity. And this challenge is particularly higher in rural areas where the national grid, where there is no national grid. One key problem is also that even when electricity is provided, even when hospitals are connected to the grid, often the electricity supply is not reliable, is intermittent, and there are significant power outages that create huge issues. And let's keep in mind that also 1/3 of the failure in medical devices is basically due to unreliable electricity supply. So the challenge is huge. Next. Thank you, Wengi. There are also some good news. The good news is that today we have a paradigm of solution that were not available some years ago or were not economically viable. In particular, decentralized renewable energy, such as off-grid solar system that represent a cost-effective, reliable, and rapidly deployment option to accelerate electrification in healthcare facility, especially in rural areas. Especially in rural areas where there is no need anymore to wait for the national grid to arrive. You can deploy rapidly a solar system. In the past few years, in the past decade, we have seen a significant decrease of cost of photovoltaic panel and batteries, together with a significant increase in technology performance and reliability. So in most rural areas, off-grid solar solutions are the most economically viable solution for electrification of healthcare facility compared to other options. Let's keep in mind also the important impact that off-grid renewables have in terms of increase the climate resilience against the impact of climate change, being independent from the fuel supply that, for example, in the case of diesel. Of course, we need to accelerate action, and we need to accelerate action to benefit and to unlock the potential of renewable and to accelerate all the healthcare facility. For this reason, the Director General of World Health Organization convened the high-level coalition on health and energy. The high-level coalition is composed by leaders of national government, international organizations, and global champions on health and energy. The coalition was convened in the framework of the Health and Energy Platform for Action, and the coalition member met in June and endorsed the strategic roadmap to promote a healthier population through clean and sustainable energy. All the document and the entire roadmap and the supporting document are available on the WHO website, but I would like to briefly mention the 6 key priority actions, let's say. The first one, considering electricity access together with the other clean cooking to development priority, which means that all healthcare facilities should be provided with electricity access, including the facilities in rural areas, including the one providing the primary healthcare service. Dramatically increase investment. It is fundamental that both the national resources are mobilized, but also the international community and development partners increase dramatically their financial support. The third recommendation provide the human financial resources to design and implement clean energy plans. These energy plans should be integrated, obviously, with the health sector planning, budgeting, and monitoring process. Fourth recommendation is developing tailored policies and financial solutions. These policy and financing approach should be tailored to the specific needs of the health sector and should be able to unlock the potential of clean solutions and energy efficient solutions that we have seen. Increasing the sectoral cooperation, obviously a challenge like this cannot be won if we work in silos. So energy sector, health sector, but also WASH, climate, the reason why we are having this workshop today, have to work together. For this reason, WHO together with UNDP, no, sorry, Maggie, too fast, 1 minute left. Just about the international cooperation, WHO together with UNDP, with UNDESA, World Bank, and with the International Renewable Energy Agency, IRENA, convened the Health and Energy Platform for Action, which aim to facilitate cooperation between the energy and the health sector and other sectors as well. And the final point, as similar to this, but is to highlight that all stakeholders need to work together, public, private, and non-governmental actors, to increase cooperation between different communities. This is my last message. All the information is on the website, and handing over to Maggie again. Thank you, Maggie, for some final considerations.
Great, thank you. I'm going to hand it back to Sylvia. I know we're short on time, but just wanted to emphasize that we recognize that we need collaborative action on climate, WASH, and energy, and there's lots of advantages to doing so. So I'll hand it back to Sylvia. Thanks.
Thank you very much to the WHO team for this very insightful presentation. We have learned about the framework of building climate resilience and environmental sustainability. We have then heard about the inequalities that already exist, particularly to pay attention to the least developed countries. And finally, about the importance of energy and how this plays a role into the quality of care. So really, definitely very important points. Now I'm giving the floor to Mr. Dave McConalogue, the Health Advisor and Lead on Climate and Health at the Global Health Department in the UK Foreign, Commonwealth and Development Office, who will share his reflections on synergies and strategic opportunities. So over to you. Thank you.
Thanks, Sylvia, and also congratulations. I think you're probably one of the few people I've ever heard pronounce my surname correctly, so that's really, really encouraging. Yeah, so I'm just going to provide just a few reflections from FCDO in terms of really why this integration between WASH, energy and the health sector is so important to us, and we feel is a key strategic position that we need to hold going forward. I'll also provide a couple of reflections on the opportunity that COP26 presents, particularly on health, but actually I think one of our really close partners, WHO and Elena, have already provided some detail on that and done a much better job than I would do. So let me just start by saying there's obviously massive co-benefits from dealing with WASH, energy and health in a cross-sectorial approach, and that's both in terms of the quality of the services and the safety of those services that we can provide within health facilities, but also in the accessibility as well, in terms of the hours of service and the location and accessibility of those services for some of the poorest and most vulnerable people who've got the highest need within that as well. It's also critically important for health system resilience. We talked about this, health system resilience generally, but also specifically to climate change. And we really need to think cross-sectorially when we're considering the resilience of the health system to climate change. And so it's incredibly important that we think about WASH, energy and health together when we're considering that, and it's a key component of health system resilience, which Elena talked about earlier. And then I think there's also really obvious benefits in terms of infection prevention control, really, whether that's dealing with preventing acute infections within facilities as part of a community response, or indeed for much wider and broader outbreaks, like for example in the pandemic. And the pandemic was in many ways a real eye-opener for many in terms of that really key strategic importance of WASH and energy and the health system, and as a key part of the response. And I think it really highlighted where the value was. It also highlighted for us where lots of the vulnerability was within health systems as well, in terms of WASH, energy, and that integration within health facilities. And I think with that, also with coming out of the pandemic, it does provide us with a platform to grow in a more sustainable, resilient and greener pathway, and to use the pandemic as a platform to launch forward in this way. But we do know that this sort of transformational change that we really want to see cross-sectorial in healthcare facilities and in embedding and integrating resilient wash and energy, that this won't be done by ODA alone. We need to think of new innovative forms of energy and finance models to be able to bridge some of these gaps. But there are opportunities as well. As Salvatore talked about, some of the renewable energy sources and solutions that we have, and these becoming more affordable, more accessible. But we also need to take advantage of the opportunity that presents us. One example of this, I think, is demonstrated by work that FCDO did in partnership with, well, very much delivered by UNOPS and the Ministry for Energy. And this was really about delivering renewable energy sources, in this case solar power, into rural village locations and using mini grids to do that. But really importantly, on the back of that is also not forgetting about how these energy solutions were going to continue to be maintained and operated. And so that also included an approach to, an innovative approach to a public-private partnership, which would enable that to be a sustainable situation going forward. I think also, and that also brings massive benefits. So particularly within that case, we saw that it gave us a sustainable and reliable access to cold chain, enabled them to increase hours of operation within healthcare facilities and made them safer to access, and also enabled water pumping as well, which is essential for delivery of wash within those services. Let me quickly finish just by highlighting the COP26 and the opportunity that we have around health. So health systems, as others have said, are absolutely essential to responding to climate change and the threats from climate change, but they're also incredibly vulnerable to climate change, and part of the resilience and part of the vulnerability also comes from the integration of wash and energy within the health system. So it's incredibly important that this has a higher political and strategic focus. And so at COP26, health has been chosen as one of the priority science action areas, and behind that, we're using that as an opportunity to engage countries to make commitments on developing more resilient and sustainable health systems, and wash and energy and that cross-sectoral work will be an absolutely key part of that. I very much look forward to hearing countries' ambitions on that as we come into October and November. Let me just quickly close by just saying very quickly that the UK government will continue to support the Global Wash and Energy and Healthcare Facilities Task Force, and we will of course be using our development and diplomatic networks to encourage others to work cross-sectorial and to also support this in a joined up way. Thank you very much. Back to you, Sylvia.
Thanks immensely, Dave, for running us through all these critical points. And actually, I found it very important to make this connection with the COP26, because, you know, the key social services until now are still very absent of the global climate adaptation and mitigation agenda. So how to look at these connections and the importance of WASH and energy to build this resilience and make the connection to this global agenda has been really, really insightful. So thank you very much. And now let me now move into another part of the session where we are going also to hear about practical efforts, challenges and opportunities that are coming from the ground to advance and implement the integrated climate, wash and energy actions in healthcare facilities. We have several speakers, and unfortunately the first one, Mr. Afshrafuddin Yuya from the Federal Ministry of Health in Ethiopia has had a lot of connectivity problems and is not able to talk. So let me move to Mr. Waltaji Tane, the Climate Change and Health Technical Officer from WHO Mozambique. The floor is yours for the next 3 minutes. Thank you very much.
Thank you. Thank you very much. I'll be very fast. I'm gonna talk on the barriers and then what is going on, and then on the future action. So as it has been mentioned, the barriers number one from the experience here in Mozambique is access in terms of infrastructure, both in wash and energy. For example, the national coverage for water supply is 56, and then sanitation is 43, no data for hygiene. When it comes to health facility, it's less, and for sanitation it is 43, and for water it's 56. For energy, we don't have data for healthy facility, but the national coverage for energy is 29%. So you will see the barriers now. And then these barriers is more exacerbated by the climate change and the extreme weather event from the experience in Mozambique. During the 2019 cyclone Ida, 10% of the healthy facility became non-functional because of the impact of that extreme weather event. The only tertiary level of hospital which provides service to 12 million was out of function for many months, including the energy supply there. So the climate change, the extreme weather event is exacerbating these existing barriers, the access of the infrastructure. So this is one of the big problems. So when the COVID came, we were looking for the healthcare facility to become compliance with infection prevention. We have to go again and then start looking the wash service and the energy service also, as we need both in the COVID service. And then some partners came and then support in on those facilities identified as isolation in the treatment center. So to improve this, there is ongoing using wash fit in Mozambique. And also there is a power supply, Power African supply supported by the US. There was ongoing solar panel supply in 92 healthcare facilities. So this is the trial. So we see big infrastructure gap, and then non-inclusion of healthy facility even to the development program of the wash and energy. So as an action, we need to encourage change in terms of regular program development. It has been mentioned by our colleagues who have presented on the energy, as these two sectors is very critical for health, but it is beyond the health sector mandate, the energy and the wash. So one gap is that the other sector, they don't look the healthcare facility as part of the plan. Now, the trial is now to address the energy and the wash in the development program of wash and the energy. So this is one of the action. We need to encourage this change as an action. And then also we need to encourage also the change beyond the healthcare facility, because still the national coverage is very low in terms of energy and also wash. So there is a need of huge capital investment to put in place the infrastructure. So finally, from the experience, now we are very clear what we need, and there is a courage to change this. What is we are looking is a full commitment for healthcare wash facility, for energy supply, and also beyond that, in case of energy in the wash, as part of the sustainable development. Unless we are not successful in the sustainable development goal in these two goals for energy in the wash, it's not possible to achieve what we want in the healthcare facility. So commitment is very important if we are envisaged to bring this change from the government as well as from the development partners. Thank you very much.
Thank you very much, Mr. Waltaji. I will make some comments together with the other presentations. We are now moving into Dr. Nurullah Awal, Health Advisor with Water Aid Bangladesh, and we have a video to show you and share with you. Thank you.
So Water Aid Bangladesh initiated the Wash in Healthcare Facility program in the primary healthcare center, namely the community clinic. In the very beginning, we did a survey with support from World Bank, UNICEF, Water Aid, and we found that the condition of the wash, particularly water source, supply, and then the sanitation, and finally the hygiene practice and options are very scarce and very limited in most of the places. So Water Aid designed and developed a WASH guideline for the improvement of WASH in the healthcare facilities, and we tried to install and implement the project in most hard to reach areas in the northeast of Bangladesh and southwest part of Bangladesh. So far we have installed and improved over 100 community clinics, and those are already designated by the Ministry of Health as model clinics, and they have already started in replicating the models in other community clinics. So very recently, with support of World Health Organization and Bill and Melinda Gates Foundation, we have started a project in Gaibandha, one of the northern district, where the wash facility is very much not in good condition, and also that area is very much flood prone. So we considered the design in consideration with the flood and the established the climate resilient washing healthcare facility, and started to incorporate IPC, infection prevention control, together with the healthcare waste management. So we are working here with supporting the design and also making the people aware of how to manage and how to sustain the improved wash components, making and take care of the sanitation complex and also the hand hygiene activity. So altogether, these are the newer approach that we are adopting in our northern Bangladesh project, and we are also considering the energy issue. So government is already taking the solar panel so that it has to be established and incorporated in the design to run the electric motor to maintain the continuous supply of water, and also to run the hand washing options. So we are very much looking forward to share the findings and outputs together with WHO and BMJF by hopefully end of this year. So that's all from our presentation in Bangladesh. Thank you very much.
Thank you very much. And let's now look at the second video that we have for this part of the session, which is a video that was sent by the Laos Ministry of Health. So please go ahead.
Since 2014, to address these challenges, the Ministry of Health has prioritised the development of WASH policies, strategies and basic health facility environmental standards and healthcare waste management regulations. In 2017, it further adopted the use of WASH Fit as a principal method to support implementation of these national WASH standards and regulations at healthcare facility level. However, the Ministry of Health faced challenges in mobilising resources for this important work, that is until this year.
มาฮอดเดือน7 ปี 2020 นี้กระทรวงสาธารณสุขของเขาได้ขยายเรียกวัชฟิตให้เป็นลักษณะปรับปรุงรอบด้านภายใต้กิจกรรมปรับปรุงของบ่อให้กลายเป็นสถานบริการสาธารณสุขที่สะอาดปลอดภัยทนทานต่อการเปลี่ยนแปลงดินฟ้าอากาศซึ่งกิจกรรมนี้แม่นแท้พอกับความต้องการของสภาพปัจจุบันของพวกเขา
During 2020, funding to support COVID-19 response globally has created opportunities to fund investments in issues such as WASH that are both long-standing national priorities and important components of the pandemic response. Within the scope of the COVID response plan, Ministry of Health has succeeded with support from WHO in mobilising over $2 million from a number of donors to boost the national Safe, Clean, Climate Resilient Hospital initiative for improving WASH services in 82 healthcare facilities in 6 provinces and Vientiane capital.
I think that the video was cut at this point, but in any case, I think that the most important messages went through. So thanks a lot to the countries that have showcased how access has been key and at the same time a challenge. We have the case of Mozambique that we're talking about the cyclone Idai, and after how the COVID pandemic hit them, and the importance on really develop and use the tools available like the WASH Fit to improve, to improve the conditions in the healthcare facilities, make them more resilient and more prepared to respond to these situations. Also, Bangladesh was highlighting the importance of having WASH guidance and tools to design and provide models on how to scale up healthcare facilities that have all the elements in place to be able to really be resilient and respond to the critical challenge that they are facing, including IPC, an important one, and then finally Laos, on the importance again of developing the right policies, standards, and strategies, and using the tools like the WASH Fit again was mentioned to increase, to realize the ways to really make the upgrades of the facilities and then be able to mobilize resources. So very, very, very good experiences coming from the field and to make us understand a little bit better what the challenges and the solutions the countries we are dealing with. So in order to make this session a little bit more live, we would like to take a moment to hear from you all about your work on climate resilient WASH and energy in healthcare facilities. So if you go to the polls tab of the Pathable page, we have two questions for you that we would like you to go there and answer. So since we don't have too much time, we will continue the session without waiting to see all the answers, but the answers will be then brought back at the end in order to see a little bit what were the results. So there are two questions we would like you to answer. The first one, very easy. Have you integrated energy and climate activities in your approach to improving WASH services in healthcare facilities? This is the first question. I hope that everyone now is on the poll part of the event. And the second one, so you're going to start answering right now. And then the second one is, where do you think efforts and resources will lead to the greatest improvements in climate resilient WASH and energy services in healthcare facilities? So please choose your top two answers in there. And then, as I said, after the next part of the session, we will be, and before the closure, I hope that we will be able to see all your answers and realize what are you telling us, what is happening, and what are your thoughts on that. So thanks a lot for participating in this poll. We will now turn to another part of the session with key partners to hear how they will continue to take action on climate, energy, and WASH healthcare facilities, starting by Dr. Sarah Thompson, who is the lead policy specialist for health and sexual and reproductive health rights at Swedish International Development Corporation. Over to you, Dr. Sarah. Thank you.
Thanks, Sylvia, and thank you for inviting CEDA to participate in this very important seminar. I'd like to say a few words about why Sweden prioritizes WASH in our development cooperation and also how we plan on carrying this work forward. CEDA's ultimate goal is to contribute to sustainable development through reduced poverty and oppression. And WASH, as I'm sure you all know, is fundamental for reducing poverty and respecting the right to health and education. In addition, practices such as hand washing and access to clean drinking water also reduce the risks for overuse of antibiotics, which, as you know, contributes to antibiotic resistance. So as such, water security, water sanitation, hygiene are at the core of sustainable development and highly prioritized in our development cooperation. Now, as other speakers have already pointed out, the COVID-19 global pandemic has demonstrated the need to make greater efforts to avoid a global water crisis. And this includes addressing and prioritizing the enormous global need of basic and improved sanitation facilities and hygiene, which are highlighted in the Global Progress Report. At CEDA, we are committed to continuing and strengthening our work in these efforts. And as members of the WASH in the Healthcare Facility Global Task Force, we will be following the developments in this work, and we will be emphasizing the importance of these efforts in dialogue with our global, regional, and bilateral partners. Specifically, we commit to raising awareness and building capacity with our own colleagues within CEDA in different sectors, and having access to the data in the Fundamentals First report has been essential to this effort. At the global level, we've identified partners with whom we believe an increased dialogue on this intersection can lead to effective adjustments. Within the water sector work, we have an ongoing dialogue with our relevant partners, and we're following progress of CETA-supported funds to areas supporting WASH in healthcare facilities and WASH in schools. In the health sector, we are exploring ways of integrating sustainable energy initiatives such as the Power Africa program into electrification of healthcare facilities. And finally, we will continue our internal dialogue, increased ownership by the health sector to assure adequate WASH in healthcare facilities. So thank you again for inviting us to attend, and I wish us all success in our joint efforts to support resilient and sustainable development through WASH and energy services in healthcare. Thank you.
Thank you, Sarah, and thanks a lot for the incredible commitment that you always have had in this subject around healthcare facilities. And we really all resonates very much with all of us when we talk about the need to increase the efforts that we are doing in this area, particularly when we have all seen the effects of the pandemic in the health systems, right? So tremendous amount of commitments. Thank you very much, because this has been really inspiring, and I hope that others will also work and join forces on this advocacy and capacity building and data and partnerships. Thank you very much.
Thank you.
We have now Ms. Wanjiru Kuria, Sanitation and Hygiene Advisor from World Vision Kenya, and I think that we have a video that is coming from her.
One of World Vision's successful models of working in health facilities is called Baby Wash, an integrated approach to programming for children in the first 1,000 days of life. One of the key project sites for Baby Wash in World Vision Kenya is in Kajiado County, an area to the south of the capital city of Nairobi. This area is largely inhabited by the Maasai pastoralist tribe, whose main source of income is livestock keeping and rearing. Overgrazing and overstocking, in combination with extreme climatic conditions due to climate change, can result in these pastoralist communities moving to new locations in search of food. One of the things that we can miss when we focus too closely on WASH in health facilities is what the conditions are in the surrounding communities. If the WASH sector supports a climate-smart health facility, but the surrounding community ends up moving away due to climatic changes, then our work has lost its effectiveness. That is why, as part of our Baby Wash program, World Vision Kenya works with community groups to enhance pasture conservation. This practice helps the community to harvest pasture during seasons of plenty and store them as hay. This stock stored not only helps cushion the livestock during drought situations, but also ensures women and children continue to access quality health and WASH services in the areas where the project has intervened instead of moving away. In this way, improvements that are made at the health facility will have an impact for generations to come. Another key aspect of World Vision's work in health facilities is advocacy with government to provide better services. This advocacy often focuses on the provision of more staff, cleaners, and equipment in health facilities, but also extends to advocacy around extending the electric grid to connect facilities where possible. Essential equipment for proper infection prevention and control, such as an autoclave, often run on electricity. Therefore, electrification is essential for proper hygiene at the health facility. As WASH practitioners, we need to continually push for more integration between WASH and energy, and not forget about the conditions in the surrounding community that will lead to use or abandonment of the local health facility. Thank you.
Thank you very much. And I think that we have a second video from Mr. Shahid Kamal, Asia Regional Humanitarian Aid Coordinator from the Swiss Church Aid. Please go ahead.
Hello everyone, this is Shahid Kamal from Hexipar, working as Regional Humanitarian Aid Coordinator in Asia. Hexipar is a member organization of the Swiss Water and Sanitation Consortium. I would like to showcase our activities from an island called Qutub Dia in Cox's Bazar, Bangladesh. Qutub Dia is having severe problems with salinity and lack of safe water. Almost every healthcare facility is lacking a safe water source. During the summer, the water level goes further down. Working towards improving water situation is especially challenging due to its climate vulnerability, difficult geography, and absence of electricity. As an island, there was no waste management system in place. Hexipar constructed a waste management zone with an incinerator and an organic as well as placenta pit. Because of Qutub Dia's geographic position, waterlogging and excessive rain, the waste management zone was constructed on an elevated ground so that it remains functional during flood and the waste cannot contaminate groundwater. Scarcity of water and absence of power contributed to lower hygiene practice and severely hampered maternal care, including delivery services. Hex installed 320-meter depth deep tube well powered by solar system with battery backup in all the family welfare centers. Now they can smoothly provide 24/7 maternal care. Let's look at a comment provided from one of the staff members of a facility. She said, "This facility did not have any water source for the last 14 years. We had to collect water from distant places, mostly pond water. Now we can provide 24/7 service without any tension of hygiene or sufficiency of water. It is a matter of joy that we have our own water source now." Thank you all.
Thank you very much. And as you have seen, colleagues and participants, you have seen a couple of two very insightful experiences looking at how community involvement is key as a key element for success in the programs, and how this impacts in the community in the long term, and as well as how using innovations can really make a difference for the water access in healthcare facilities. So thanks a lot really for these very wise words and experiences. We are really running out of time, and I really don't want to really cut short for the closing, because I think that we have very important messages to hear. Let me then just come at the end of the session, but before that, someone will be posting in the chat the results of the poll, so that you will see after the session, you will still have access to the poll, to the chat, and you will see the results of what you have been answering in there. So let me now, without further delay, come to the end, and it's my pleasure to invite Dr. Anshu Banerjee, Director of Maternal, Newborn, Child and Adolescent Health at WHO headquarters, to make the closing remarks. Over to you. Thank you very much.
Thank you very much, Sylvia. It's been a wonderful session, and wonderful to see how committed people are to take this issue forward. Basic wash and energy, of course, are fundamental to improving and achieving quality of care. And for my department, let's say, in particular also for safe childbirth and maternal and child health services. Maternal and newborn mortality is highly inequitable across regions, let's say. And the highest risk are, of course, concentrated in sub-Saharan Africa, where it is sometimes 55 times higher compared to the lowest mortality in other countries. And at the same time, sub-Saharan Africa is also where wash and energy gaps in healthcare facilities are greatest. So in order to improve quality of care and improve the outcomes for mothers and children, we should also be able to address wash and energy in those health facilities. But as we've also heard, also within the community, and we should not forget the link with the community. We have global standards, we have mechanisms, and at the same time, I think it's important, as we saw in the initial presentation, it's important for countries to set their baselines or to assess their baseline and develop national plans, including setting their standards. Growing threats and repercussions of climate change mean that we must ensure that all public health interventions are climate smart and resilient. And this includes simple measures such as including water storage, but also, as we've seen, how to improve waste management using solar panels for energy, as well as looking at how we can have a national climate resilient healthcare facility and health system. And it's important for countries, therefore, also to set a target for their health system net zero emission. And hopefully the COP26 can really gain momentum and support this initiative. And final point maybe is that, as stressed earlier, it's important that we all collaborate with each other and coordinate. Global partners need to increase collaboration, investments, and support to countries. We have several networks that can support this. We have the WASH Healthcare Facilities Task Force, which is looking at better diagnostics or better diagnosis of bottlenecks in health facilities. At the same time, we have the Quality Care network for improving maternal, newborn, and child health, which also looks at WASH and energy as part of their core standards. And so I encourage all of us who are not engaged, let's say, to join these efforts through the platforms presented. We have a lot of challenges at country level, including multi-sectoral collaboration, financing, monitoring facility infrastructure, and yet we have solutions and technologies. And so together we can do more, and in doing so, we can improve the health of billions. Thank you very much for joining us today. And I hope that we will continue on this exciting path to deliver the global sustainable development goals. Thank you very much.
Thank you very much. And colleagues, we are closing now the session. If you have voted in the polls, you will be able to see the results that we have achieved. So said that, thanks a lot, and have a happy end of the day, happy World Water Week. And thanks a lot. Bye.